So one I want to talk a little bit about, I know last time we talked was right after the last CARES Act passed. And so I want to talk a little bit about CARES 3.5, as we call it. Some people call it the fourth bill. And it is the fourth bill that passed, but kind of an extension of the CARES Act from before. And one, as we talked about, there are two crises right now in the country, the healthcare crisis and the economic crisis. In this recent CARES Act, for the most part, was trying to focus on the economic crisis, particularly the payroll protection program. And the payroll protection program is a program for small businesses, 500 and smaller. And I know there were some businesses that got highly publicized, but the law really allowed businesses that had different sites, but less than 500 people at the site. And the restaurants that were mentioned, I think they gave their money back, but actually were shut down. They were, I think a couple of them may have had drive-throughs, but a couple of them were completely shut down. And so I know that they gave the money back, but now their employees are going to go on unemployment instead of PPP. So the money's still going to be spent in that direction. But we unfortunately, there was the original $350 billion that was set aside for the PPP. That went very quickly, and it wasn't a lot of big businesses, as we just mentioned, were in there. But the actual average loan was about $200,000. So there were 1.7 million loans given in the first round, and about 75 companies kind of made the headlines. But remember, there were about 1.7 million loans. And the people that I talked about, the bankers in our area, the community bankers, one guy said his average loans were he gave about 100 loans and about 60,000 per loan. So, it did reach who it was supposed to reach, but the problem is it was just the need was far bigger. And Senator McConnell tried to do unanimous consent to continue that program before it expired. And he was unable to do that in the Senate. And so after the Senate passed the bill, we flew back and passed it as well. And so the PPP program, we've been talking to our banks and small businesses, is working for small businesses. The average loan right now is about $100,000 for businesses moving forward. Also hospitals, there was another $75 billion allotted for hospitals, and we can talk about that. And I want to talk about quickly what's really happening in Kentucky. Is I don't want to say something you guys already know. I want to go through this and get to questions. But, in Kentucky, and every state set aside capacity for in case we became a hot spot. And fortunately, we do have cases, and there's some tragic stories here, but we haven't really become a hot spot. But because of shutting down all of elective practices, our hospitals have really been hurting. One hospital in my district has already made an alliance with Owensboro, a smaller hospital, because of, that must have been in the works before because it happened quickly. I don't know that it wasn't, but I do know that the hospital struggled because they didn't have COVID patients, thank goodness, but they also didn't have other patients. And so we're facing where a lot of I've heard from Ethan McDowell and others have laid people off because of what we're moving forward. On the health side, so we did put money in for that, and that's going to be distributed hopefully in the next couple of weeks. But on the health side, we're focusing on testing. I'm frustrated as where we are on testing. Abbott's putting out about 50,000 tests per day. They estimate they could do 65,000 tests per day by June, and we're just kind of trying to figure out why in 2 months they can only do 15,000 more tests. We're not sure where that's coming from. We do know there's capacity at some of our labs that LabCorp and others that seem to have capacity are not being used. So I know the president's the White House has put out a blueprint for testing to states and locals, and we just trying to get all hands on deck to figure out where the problem is, how we can make it move forward. And there was funding in the last bill. There was money for testing, and part of it, I was on a phone call with Dr. Francis Collins, who's head of the NIH, and their program called RADX. It stands for Rapid Diagnostic X. I'm not sure what the AX is, but Rapid Diagnostics to really push from his level. Dr. Collins is a very highly respected person. He's actually Dr. Fauci's boss, so he's at the highest levels of the NIH in a pure effort to get diagnostic testing readily available at point of. So you walk into your physician, you get a test, and they can get an instant read. That's what they're focusing on. And to really get open the way we want to be open, that needs to be in place. And so we're hoping sometime, we're not going to be there by the end of May probably, hopefully sometime in the summertime. the thing that we're most focused on my committee, so I'm on the subcommittee for health. I'm also on this ranking member of the subcommittee on energy and commerce for oversight and investigations, is one testing that we talked about, and we can get into it in questions. The other is the therapeutics and vaccines that are moving forward. We had a talk about, and I'll say it incorrectly, but remdesivir, which has really promising. The scientists that I typically talk to will be very hedging. Well, we don't know, and you hear them on TV, but they seem very, very positive about the first test in remdesivir, to the point where the people even in the control group are probably going to get it, because it would be unethical not to give it to them now that they really feel that it works. Having said that, remdesivir is not like Tamiflu, so it's not going to be you go pick it up at your local pharmacist and take it if you get COVID. It's an intravenous drug, so it's for the most critical, but it will lower the stays in ICU and the death rate, which is so important. So they're also studying hydroxychloroquine, which there's mostly positive, some negative. No, it's been headlined and been emphasized, but they really think there's some great possibilities of hydroxychloroquine. There are others that I didn't have the name for, but there's some anti-cancer drugs. So the problem they're seeing is the body's immune system in the most critical cases is overreacting. So the inflammation by the immune system overreacting. So there's some cancer drugs that they're looking at that seems to keep the body's immune system from overreacting. It's not really killing the virus, but keep the body's immune system from overreacting. The next thing that's really big is a vaccine. And Dr. Collins, so the people that you report to and our people in our area would be, I think, interested in this. He said they put together a public-private working group at NIH for the vaccine. He said he's seen these groups before on other things. He said it usually takes about a year just for people to get acquainted. He said he had working groups up and running in about a week. So everybody is serious. Everybody's working in a bipartisan way from our side of it and pushing them in a bipartisan way. They're trying to come together to work on a vaccine. He said, so there was a question. We had a phone call with him about, what about does coronavirus mutate? And he says, well, it's an RNA virus. RNA viruses mutate, and you see it with the flu. You have a flu shot and they have a flu season, and then it comes out a little different the next year. And so the vaccine's not as effective, or the flu shot's not as effective. He says so far in coronavirus, the protein that it produces doesn't appear to be mutating at all, although the virus has slight mutations, and the vaccine blocks the protein. And so they're very optimistic that they can do a vaccine. Because the question is, can you even do a vaccine if the virus continues to mutate, like we've been chasing the flu vaccine for years? He says it appears the protein is pretty steady. When I say appears, there's always caveat that this hasn't been proven in testing, but they're optimistic. So what they're looking for is a promising vaccine. And he said there's a lot of promising vaccines. So you look at what's promising and what's scalable. So we need tens of millions of vaccines as sooner rather than later. Hopefully by the end of the year would be kind of the earliest target. He wouldn't commit to that, but that would be the earliest target. So they have to look at, all right, what's the most promising, and is it scalable if it's promising, and then how do we put the manufacturing in place? So what's going on now? Typically, when somebody's bringing a drug to market, they will do the testing. They'll go through the FDA, get the FDA approved, and once they get the approval to move forward, they'll start gearing up for manufacturing. And that makes sense, because if you're a drug company and you get all the way to the end and you've already built your manufacturing facility and you don't get approved at the end, then obviously you invested money that you can't reclaim. So, but this is, once they start focusing on the vaccines, not just one, but vaccines that they're going to go forward with, part of the CARES Act and some of the money we've invested in taxpayer money is going to go to get ahead of it and start building manufacturing facilities and helping them with product. I don't say manufacturing, I don't say new plants or anything, because I don't know, but helping them gear up for manufacturing. And the reason for that, production. The reason for that is, he goes, we don't want to have a vaccine approved the 1st of November and take another year to get it produced. We want it being produced when we can. I know that was an issue with Ebola a few years ago when our own Kentucky Bioprocessing had a very promising drug but you had to really wait for a tobacco plant to grow before you could harvest after we realized it was working. And so they're trying to work through those kinds of issues. And I don't know specifics. I don't know what the vaccines are looking for, but I'm specifically, this is great reaction to Ebola, but it was going to take a while for it to be mass produced. And so they're trying to simultaneously predict what's going to work, help businesses express it through the testing phase, and simultaneously help them through get production ready. So we're going to have some production facilities that won't be used that we're going to build, but I think the risk is the reward of having doses readily available when the vaccine is approved is worth moving forward, is worth that risk for us, because we already know it's already been a $3 trillion disease at the minimum, and that's not even talking about lost revenue and then of course the tragedy of lost life. So I would focus on the economic and the health side of it. I can talk more on that, but I'd rather talk to the questions you guys may have.
This is Lauren again. Hey, I'm just gonna, just one note I forgot to mention earlier. When you want to ask a question, please just introduce yourself. With the names aren't always popping up as who exactly you are, so please just introduce yourself and say what publication you're with before you ask your question. And start the video so we can see you too. Thanks.
I see Brandon and Eva and Jim. So one of y'all go ahead, whoever wants to go first. I see Eva talking, but I can't hear you.
Okay, sorry. I just
there you are. Okay.
Okay, I guess I'll go. Hold on 1 second.
I could hear you. I can hear you, Eva. Yeah.
So Speaker Pelosi said that she is eyeing $1 trillion for state and local government support in the next CARES bill. Where do you stand on that? Do you think that's an appropriate number?
I just don't know what the number is going to be. I think that's why we need to get back to Washington and start working through the process on moving forward. There's going to have to be assistance to state and local governments from the federal level. I still think there is something we have to look for. And what the number is, I think that's why the committees need to get together and start meeting and moving forward. And because of speed and understand we had to get small businesses were laying people off. We had to get PPP out. But we really have had a handful of people in a room negotiating a bill, and the rest of us flown back just to vote yes or no. And we're $3 trillion in now. And so I think we need to take time to let this work itself through. We're still trying to figure out how to assist the hospitals, which I know is a big, we had the $100 billion, which $30 billion's already gone out. Another $70 billion they're working to move. There's another $75 billion that HHS is moving. So that's just an example of all the other departments that have money trying to move forward. My thing is we need to get back and have hearings. And we get back, I know we talked about this when I was voting and leaving the Capitol, is I believe we need to look at the COVID cost, the cost of the disease, and there's some lost revenue because businesses had to shut down. And so state and local governments have lost revenue. We need to look at that. We just need to be careful that we don't go back and try to make up for, we know states in our own state has had issues with this pension program prior to COVID. We don't go try to spend money trying to solve states' problems before. I don't, taxpayers from other states solve taxpayers for states that didn't make the right decisions before. But I do think that states have been hit. We're going to have to find a number. I'm not sure that it's $1 trillion. I'd like to see how she came up with that number and how she's estimated that number. I haven't seen anything specific on that. But I do, so I'll answer your question. I do think that there's going to be another necessity for us to do that. And we need to focus on expenses to states because of COVID and lost revenues to states because of COVID.
What about direct payments? Do you think that should be included in the next bill?
Well, we need to see how much states have lost and see. And so, yeah, we need to be open to everything in the bill.
Direct payments to individuals, I mean.
Oh, to individuals. We need to see, so personally, if people are on PPP or unemployment, I think the direct payments were there because we really needed a bridge to unemployment. We still have people in Kentucky trying to sign up for unemployment that the system's working itself out, but they've been unemployed for 2 or 3 weeks and been unable to get unemployment. They should get their back pay with unemployment. So people who were working should either be on PPP where their employer's paying them are on unemployment, and unemployment goes longer, but PPEs for another 8 weeks. Unemployment can extend beyond if they can't get a job. And then we need to look at it. But I think if we're going to do something in the near term while PPP and unemployment is still in place, then not direct payments.
And then are you comfortable with the level of testing that we are at now as a country? Do you think places like Kentucky are safe to open up with the level of testing that we're at right now?
Well, I think we're safer to open up. I'm not comfortable where we are with testing. I said at the very beginning. Hopefully my O&I subcommittee is going to really look at why is it taking so long to get testing in place. And I do think that if you look at, and I think the governor of Oklahoma actually said it well, that he has, so when Dr. Fauci always talked about lowering the curve or flattening the curve, the real catch was we're not going to have 0 cases and we're not going to have 0 people get very sick from it. If we waited till we got to 0, we would never open the economy up again. So there's a balance that you have to get. That's where you would like to be, but you have to keep the critical care below the capacity of your critical care, the people who need critical care below the capacity of available critical care. And that's why you saw all the elective procedures shut down. So make sure we had hospital beds. I think the governor of Oklahoma said he had 300. I just heard him say, I haven't heard our governor say this, so I'm not saying anything about him. I just don't know. But had 300 cases, severe cases, and 4,000 beds. And so we can open it up slowly. That's going to be a tough decision governors are going to have to make. Because once we open up, if it's a communicable disease and we become more communicable, obviously people are going to get cases. And the thing, as long as the system has the capacity to care for them, I think we're going to have to move forward. But testing is critical to that. So I think we can, the governor's already started on healthcare opening up here. So I know a couple of dentist offices in our office complex I'm in now is seeing people are near our office complex. So we're able to open up, but to get widespread where we're having, I think he's still looking at like no more than 10 people meeting in certain, those kinds of criteria. To get where it's more widespread, where people can go back to normal, we're going to have to be more testing. And I'm not comfortable where we are now.
Thank you.
But I do think we can go beyond where we are now, given the system that we have. Just to get even wider open, we're going to have, and hopefully by June, I think if I saw like the hairdressers and so, we're going to be open May 25th. So that's kind of like at the last stage in businesses opening. So hopefully by early June, we'll be there. I was hoping we'd be there now on point of care testing. We're not there where we need to be on point of care testing. Hey, Jim. Well, you're right. And most everybody you talk to in Washington are concerned about how much money is being spent on this. The issue that happened, and when the governors and the president with the direction and the governors made the decision to shut down the economy, I think once what we saw with Italy and what we saw happening in New York and overwhelming the hospital system, and that could go to anybody's community. So a lot of people are looking at, well, we didn't really become hotspots. So why did we shut down? And what we really don't know, did we not become a hotspot because we shut down? So I think the leaders who made those decisions made the best decision they could with the information that they had. So I agree with what they did. But it did. I mean, if you're a small business person and you were told you can't cut hair, you told you can't serve food in your restaurant, you were literally shut down. And so we had to do where we are. I think we're at the debt level as we were in the 1940s with World War II. Hopefully the last time we had a pandemic this bad was in 1918. So hopefully this is a 100-year thing. And so this is hopefully a once in generation pandemic. So it's going to take a generation to get out of this. But the options were very narrow, unless you just wanted the options were let the virus run its course and see where that leads. And I'm afraid that would have overwhelmed the hospital systems. The other option was, well, we got to shut down and just everybody fend for themselves. And I think we struck the right balance. it was an expensive balance. I'm not denying that, but I don't think either extreme was acceptable. Okay, well, we're still, I couldn't quite hear everything you said, Jim, but I think I got the gist of what you were talking about. And there was relief that has been sent to Kentucky. Louisville, because of its size, having 500,000 or more, gets a specific, or about, I don't know the actual number that's going there. The rest goes to Frankfurt to be disseminated through a process that Frankfurt's putting into place. But that is for not necessarily replacing lost revenues, but for COVID expenses. And I think the question that Eva said, we are going to have to look, I think, that lost revenue related to the COVID issues, we're going to have to probably look at something in that direction. The current relief isn't really designed just for lost revenues. It's more designed to help states with the expenses of COVID that's cost them. And we can get you more times where we think that'll be distributed out of Frankfurt. But most of the funding like that, other than it was designed for cities of 500,000 or more, not just Louisville, not just Kentucky, but all cities 500,000 or more. And so the states that have a city that big, the first chunk goes to the city of that size, and the rest is distributed by state government.
Congressman Guthrie, Brandon, Jared.
Hey, Brandon.
Hey, how are you?
Good.
Hey, so I have some questions about this phased reopening of the economy. When we're looking at opening, either on a case-by-case basis or looking at those federal guidelines, the response that someone maybe in Louisville versus someone in Simpson County, maybe they might take, or what considerations are you guys taking in this phased reopen when you're looking at a metropolis versus more rural location?
Well, that's a decision that the reason that's best made by the states and local governments. I think the White House is issuing guidelines, what they expect to let them decide. I know my son and daughter go to college in Chicago, and I'm very familiar with across the river from Paducah. So if you live across the river from Paducah, your dynamics are just so different than if you live in a city like Chicago. You just don't live that close to each other. Right? And it's a communicable disease, as we've seen in New York, the closer you live to each other, the more like obviously the odds are higher that you come down with it. So it's hard for Washington to set a standard for the whole country. And as you point out, it's difficult for a state to set a standard for an entire state. You know, Louisville's different than Greene County, for instance. And so hopefully we can, but the issue you get to, and I think that's why some governors and our governor decided let's work. It's hard to open up in Ohio and Indiana if you're not opening up in Kentucky or Tennessee on my side of the state, because if Tennessee opens up, people can go there. And so you've got to kind of work in concert. I think they're trying to do that. So governors working together and then governors working with local officials is the best way to do it.
And Andy Beshear Governor Andy Beshear is asking all Kentuckians beginning May 11th to wear a mask to prevent the spread of the coronavirus. We have a lot of people who have some hard-pressed feelings about that. They consider it a civil liberty is being entrenched upon. What are your thoughts on that?
Well, I plan to wear a mask. I mean, that's what the governor's asked us to do. So I'm not sure. I just don't know if he has legal authority to do or not to and what moving forward. But having a mask prevents, wearing a mask is not as effective in preventing you from getting it, but it's effective from preventing if you have it to spread it. I'm hopefully by May 11th, we'll be traveling to and from DC. So I'll be flying and I'll be in airports and I'll be whatever. So I plan to wear a mask.
Okay, thank you.
Right. Well, we'd like to see if there's a phase 4 getting in phase 4. We hope to get it into phase 3, but we weren't able to do that. It's just the dynamics of all the pieces coming together sometimes. But you're right. So the Safeguarding Therapeutics Act, I went to JFK Airport to our customs and entry where the mail comes in, mail processing center. And if somebody sends in a fake or a fake drug, and you can see them, I've seen pills that they just have the logo just a little off because they're not as well manufactured or whatever, it can be destroyed. But if it's a medical device by quirk in the law, it has to be sent back. They can either store it or send it back. And I had customs officials there telling me that they have opened them, said we got to send this back, taped them and send it back, and saw the same package come back as they taped it. So whoever received it is trying to send it back in. And so they wanted permission to destroy it. And so we started working on this bill prior to Corona. But now I think if you go on the website, you can find testing kits. You can find all kinds of things that aren't FDA approved, probably aren't effective. We know, I mean, I would bet aren't effective or fake. And so I think the urgency of people receiving, if counterfeit, some of the counterfeit stuff that they actually try to use ingredients and make it work. Some of the stuff is just fake. Both of it can be dangerous, either category. And so I think you're seeing, just because nobody has an approved vaccine or nobody has approved therapeutics, nobody has really gotten there yet to even copy. So people who are buying those, they're fake. And so we want to make sure we have that loophole closed, and hopefully in the next bill we'll have that. And Elliot Engel, I don't think he represents JFK, but he's New York. So we teamed up together after I toured it, because I'd heard another on my committee, a doctor, say he went there and you ought to go see it. So I went, and then Elliot Engel, who lives in New York, I said, we need to work together on this. And that's what you're seeing more. A lot of us are calling our colleagues that we work with on a regular basis. I'm my chairwoman of the committee. I'm ranking member is from Denver. So I've called her. Denver, Colorado is opening up as well. Of course, you keep hearing people talk about Georgia and Oklahoma, but the governor of Colorado, who I got elected with, his name is Jared Polis, is a good friend of mine, is opening up Colorado as well. And so we've been trying to share ideas on that too. So nice for people to know that we're working together. And I don't see Jared Polis getting interviewed as much as Oklahoma and Georgia, but Colorado is doing the same thing.
Have you heard from your constituents concern about access to broadband? Everything is online now. And has that been an issue in your community for students being able to do distance learning? And is that a concern at all in this time, trying to increase access to broadband?
It is a concern, and I've had it specifically from the county judge of Hancock County. They've kind of, the way the geography of that county and the way it's laid out, it's always kind of been in between phone services, and they struggle with that. Now that their kids are studying at home, that's really, so the problems that we've all said, that we've looked at, lack of access to broadband, particularly in rural areas, but even, edges of Bowling Green have that same problem. We need to fix this. People are frustrated, people, whatever. But now that we're having kids home learning, it shows that they can't even learn. As a kid who doesn't have access to broadband certainly doesn't have the same access to education as the one that does. And if a phase 4 includes an infrastructure program, I'm going to be pushing for rural broadband to be part of that.
It sounded like Clyburn introduced something today. Do you know about this bill?
I haven't seen that. I haven't seen his bill today. But if he wants to work together, I'm willing to work to move forward. But hopefully something will get into an infrastructure bill on rural broadband. It's something we've known. I mean, the problem you get to with it is that you can certainly make a business case for somebody to put broadband into the city of Bowling Green, although I can show you edges of it that doesn't have it. And you pay for it and it pays itself back. But the lone person who lives out off the main road, or the handful of people who live off the main road, or counties that are off the main roads, entire counties don't have access to broadband like they would like. We've known that, and we're trying to, we have RFS and different kinds of funds to try to do broadband mapping. But now that this has become critical, it's exposed, I guess, because now you can always talk about who doesn't have broadband and who does, but you send a kid home from school and they don't have the same access to an education that somebody else does that has broadband. It absolutely illustrates the problem and know that we need to fix it.
Why is it so difficult? It seems like Congress has been talking about this for years. Have you all made progress on this front of expanding rural broadband? And why is it logistically so tough to achieve?
Well, it's just a big country, and it's expensive to do into rural areas, to move broadband into rural areas. So we've looked at how you can do wireless broadband, how you can do, like, is 5G going to take care of the need to do broadband? So 5G will supplement that problem. So there's a lot of debates on the best way to do it, but it's expensive to do. But if we're going to be spending money on infrastructure and stimulus and getting things moving again, that would be the prime category to do that.
Thank you.
Thanks. You can ask again if no one else says. Jim or Brandon, you got another question?
I actually have a question about immunity, and I think it really relates to this slow opening of the economy. The World Health Organization said about 5 days ago, or we'll say a week ago, that immunity may not be possible and people could possibly be reinfected twice. And, you know, there's this sort of relaxed, I think you could say, attitude for people who may have already had the virus. So is there any talks about reinfectivity going forward until there is a vaccine?
Okay, so that's good. I thought you were going to talk about immunity with the trial lawsuits immunity. But so immunity, I just had a phone call with Dr. Collins. Even in New York, they think about 80% of the people in that area would not have been, even if would not have the antibodies because they didn't come down with it. So, answer your question. They really believe if somebody has had coronavirus and have the antibodies, they're not immediately susceptible to being reinfected. So it'd be like if you get the flu in February, you're probably not going to get it in March or April or May. They really feel pretty confident about that it's not readily. So if somebody has it today, they probably wouldn't get it in summertime or moving forward. What they don't know is how long that immunity, is it a lifetime immunity or is it just something that wears itself off like the flu does? They don't know that. So if it's not a lifetime immunity, then by the time a second wave would come in September or October, if coronavirus behaves like flu virus does, then people would be subject to reinfection. And so but they just don't know. But they do strongly feel that people aren't immediately susceptible to be reinfected if they've had it. Of course, we've only had this virus in our country since January, so they're really judging from a very small group of people, but they feel like, and then we got into on our phone call about the antibodies in the serum and the plasma. And what they would like to see is, right now you take plasma from one person, give it to another. And the belief is it's worked in the past. It's an old way of doing things, they said. So it's worked in the past. So there's no reason to think it wouldn't work here, although it's a new virus. So that every scientist I learn always hedges. This hasn't been studied, but in theory, it should work. But the other thing is you take plasma from a lot of people, and then you can somehow take a serum of just antibodies that are combined, and that seems to be the most effective. But that takes a lot of people, and it takes people who are infected and knowing they're infected and then drawing the antibodies. So getting back to the antibody testing is important. But actually, the good news is people don't seem to be readily reinfectable if they've had it. I may have just created a word, but I'm not sure.
How soon do you think that we could see some of that antibody testing here in the Commonwealth?
I would assume by summer. We have the RAD testing, RADX they call it. It's a program that was funded in the last CARES for testing. That's going to be part of it. I just don't know exact dates I could give you. I wish I could give you a date on that.
Okay, thank you.
All right, thanks.
Congressman Guthrie.
Yeah, hey.
Hi, this is
Good seeing
Allison
ya.
Shepard with the Lurie County Herald News.
Absolutely, yeah, good to see you again.
Working from home. So in regard to the PPP program, you obviously put in yesterday's paper your request for District 2 to take advantage, sign up.
Right.
Okay. with that specifically, do you have any kind of numbers yet on the first wave of the help that came to District 2 and then specifically to LaRue County?
Yeah, I don't have an exact number. I know what we can do is talk to I know the banks in your area that typically, because somebody from Hodgenville could bank in Louisville for all we know. I mean, so it goes through the local banks. But what we can get for you, and if they would share it, I'm not sure if it's private information, but I assume we could talk to like Magnolia and a couple of banks such as that and ask them how many cases they've moved forward. I don't have an exact number by county or even by district, really. I know that I've talked to several banks, and some have up over 1,000 applications and approvals in, and some have as low as 100. I had one bank I think had 18 in, but it was a really small bank. So, but the really small banks with really small business customers are able to access it and get loans. I just don't have a conglomeration number. We've been checking to make sure banks are in the system. And once they're in the system, then it's just a matter of them processing the loan application and getting it approved. And the big issue was getting in the system. And so what happened with that, just so I can get back, if you think we passed the first CARES Act, the third bill, and Secretary Mnuchin said, we did it on a Friday, and Secretary Mnuchin said, by next Friday, we're going to be making loans. And I just was astounded. I said, well, I know we have an ambitious president. I know you're ambitious. That's what I thought. I didn't say, but more power to you. And they absolutely were. Now, having said that, doing something that quick didn't mean it wasn't without glitches. And what we found is banks that did not have a previous relationship with the SBA had trouble getting registered. And so bigger banks typically would do those kind of loans. And so some small banks were kind of locked out early. I literally was calling Majority Leader Kevin McCarthy, who was calling Mnuchin and giving him names of a couple of banks that were just struggling some of the smaller banks in the district to get in. And everybody, as far as I know, in our district are in. Now, some of them got in after the first window closed. And so I think everybody is in and operating now. So every small business that qualifies for a loan, and the bank has to take them on as a client. So
right.
Typically it's a bank that already has a banking relationship with that business. Almost all small businesses have somebody they do business with. And then, so that was why we did it that way. Because think about it, we had 4,000 banks that are making loans now, and some number of them had trouble getting through the SBA. Imagine if the SBA had to process 1.7 million loans. That's what the first round was. And so we made the decision early, and I'm going to say we as Price Center McConnell, that we need to work it through our banks. So banks take so essentially the customers they have a relationship with, and the money going to the customer is really coming from the bank. So the bank's making the loan. And at the end of 8 weeks, then the SBA will reimburse the bank for the loan for if the money by the business is used for what's allowable. That's keeping everybody on payroll, including benefits, and also any like rent or mortgage interest payments.
Okay.
But I'll get you the numbers we can try to dig around and find numbers from LaRue County.
Yeah,
Okay.
we can see what numbers we can find. This is Lauren from Congressman Guthrie's office. Jim Mays, I think you're still on the call. You sent me a message with a question. Assuming there is a lull in infections in the spring and summer, what is the role of the federal government going forward on testing and preparation for a possible fall surge? So far, the states have been asked to craft their own plans on reopening to take the lead on testing and on acquiring PPE. I believe the president described the federal government as the last resort on testing. What is the federal government's responsibility going forward? That's from Jim.
Well, what we're trying to do with testing is almost every provider that in our district has one of those Abbott ID Now machines that you can, it's point of care testing, that if they had the test, so you have to take a test strip. If they had the test strip, you take the sample, put it in the machine. Almost all of them have the machine, and that's the 5-minute positive, 15-minute negative. And it's in every facility. And the problem is a lot of governments are taking these tests. So when these tests first came about, and I get it, everybody wants to help, and everybody's doing it for the best reasons of all. Everybody wants to help. But I think, and just numbers I put together, about half of those tests are being distributed out. So for instance, if I'll just say Bowling Green because I'm sitting in, but if a provider in Bowling Green has a machine and they order them from Abbott, they may not get that test because it's going to maybe a public health center goes to Frankfurt, goes to a public health center. So I could be a provider with a test right next to me, a machine right next to me, but I got to take a sample, send it to Frankfurt to go to a public health lab so that I can get a read back because all the tests are in Frankfurt. And I'm not saying that's going on in Frankfurt. I heard from some other states doing that, but that's a real problem. So what we're trying to do is get the supply line between the providers and the manufacturers to them. Having said that, we've got to make sure that it works. And it seems to me that every time the federal government takes tests out of the normal flow to help, it doesn't help. It hasn't helped to the level that we want it to help. It seems like it'd be better if those tests, and then you get to, and the problem that the federal government has to get involved with, and that's where it becomes cumbersome and difficult. Let's say I'm Brett Guthrie doctor, and I need 500 tests, but it took me forever to get 500, so I'm over 5,000 just so I know I got 500. And then all of a sudden, the tests aren't going to the right place in it. So that's something the federal government needs to be in the role of to make sure people aren't over ordering. But as we commandeer and try to distribute, it really upsets the normal supply chain. And I think we would have tests quicker at the point of contact if we weren't trying to distribute them from Washington. And I think that's where the president's going with that. It's not Washington's responsibility. It just thinks it can work better if we move that way. The other thing that we're going to dig into, Jim, is that for some reason Abbott can do 50,000 tests a day. And they said in 2 months they can do 65,000 tests a day. So in 2 months they're going to go to 15,000 more tests. And we want to figure out why that is such what I think is a low number. What's in the way, and does the federal government need to? And because if you're a private business and you say, hey, my tests are the hot thing, they're going to be hot for the next 3 or 4 months. But after that, if we get a vaccine, they may not be. I'm not going to go build a new assembly line. Well, I think we as citizens, we know this has cost us already $3 trillion. We say, hey, we'll help you build a new assembly line. We got to have more tests. We've seen that with masks and with other PPE. And so I just got a call from a provider here in this area that does textiles that has 1 million masks ordered by HHS that's still sitting in a warehouse. And we need to get them out. So we're trying to figure out how do we get them where they need. They're not, I want to correct, they're not medical masks. So they're not what you could use for surgeries or elective procedures or whatever, but they're the kind of masks that qualify you to wear as you fly, if you go to Lowe's, if you go to wherever, or Home Depot or Motley Lumber. I guess I should name them all. If I said one, I'm sorry. But they're the kind of masks that we can wear that meet that standard. And so instead of people taking surgical masks or other things, they can wear those. And there's 1 million of them sitting in a warehouse we're trying to get distributed right now. So the federal government had ordered them. Now they're sitting there, and we're trying to make that work as well. So it's all hands on deck, but we need to be careful how heavy our hand is and disrupt the normal chain of supply chain. I can hear you now. So we pretty much extended the way that it was before because of the speed of that we needed to move it through. You know, of the 1.7 million loans, the one article that I read, it was in the Wall Street Journal, that seemed to kind of point out the bigger players. They listed 70. They said there were 75 loans. They were looking at people who maximized the $10 million loan. And even if you look at the businesses that gave the money back, you know, Ruth's Chris Steakhouse, the way it was set up, you have to have 500 or less employees. And so they're like, for instance, I'm in my office here in Bowling Green. I can look out the window and see a Courtyard Marriott. Now, Marriott doesn't qualify for that loan, but the people that own that Courtyard qualify for the PPP loan because the people that run the front desk, maintenance, whatever, work for the local franchisor. And so we got to be careful how we report and say things. Ruth's Chris, my understanding is they were dividing in a couple of different companies, so they start where they qualified. But remember, what nobody really reported in that story, Ruth's Chris has shut down. I don't know. I don't go to Ruth's Chris quite often, quite honestly, but I don't think they have a drive-through and probably not delivery. And so their workers, if they're not on PPP, are on unemployment. So, I mean, I know that's so about 75% of the PPP has to go towards payroll. So there is a 25% difference between, but their workers probably would have made more on unemployment than PPP, unless the waiters would get the tips there, but just their regular kind of workers. And so, it may have been more expensive to have them now that Ruth's Chris is not taking the money and putting them on unemployment. It certainly will cost the state more money because the states have part of unemployment, but it may cost the government more. It's hard to know that, but we're mindful of it. I can tell you that the average loan now is about $100,000 in this next tranche. So it is getting to where, and the previous loan, I think the average was $200,000. So it was getting where there were very few $10 million loans. It was getting where it needed to go for the most part, with those exceptions that most of them have given the money back. We got into a pretty popular story on some cable news shows with Harvard. Harvard has Pell Grant students. And so we had a formula that based on Pell Grant students. And so money went to Harvard, and people say Harvard's got $40 billion and they're getting this money, but Harvard has $40 billion and their students are getting Pell Grants. And so I know it's easy to report things that way, but it was really targeted towards the disadvantaged students. And Harvard has disadvantaged students. I'm not defending Harvard, but anyway. Yes, hey, how are you doing?
Hi, I'm good. This is Kelly McKinney from the Springfield Sun.
Good to hear from you.
I'm sure you've seen that here in Kentucky, more than half of the deaths from COVID-19 have been at nursing homes. Is there any action going on at the federal level to help with that, would help nursing homes maybe spread out, to other facilities to keep residents further apart or anything along those lines?
Well, that's just a tough situation. I know we had it in Morgantown here, and Grayson County's had some issues with the nursing home. It's the problem with the issues with the nursing home. It's the most vulnerable population. I would say a vast majority, if not all, are seniors, and they live close together. And so once as we saw in Seattle when it first came here, once it gets into a nursing home, it's just hard to keep it from infecting others. Immediately when that all happened, there were infection protocols that got put into place by CMS. They're trying to figure out how to up that even more. But as workers, they have to have workers, and as workers come and go to a nursing home, hopefully we need to get better testing. I think it gets back to testing for workers moving forward, but that's the most vulnerable population in the most vulnerable setting. And I know they're limiting people. I have a great uncle or a cousin, I guess it would be, my dad's cousin, that's in a nursing home that I usually visit. I haven't been since all this work out. And a lot of us, you see the stories on TV where people are getting married and they go by the nursing home so their grandparent can wave at them out the window and so forth. And currently people need to stick to that. But as long as you're going to have employees in the nursing home in a way, there's always a risk. And so testing, that's where once the vaccines are available, people who work in those environments need to be the very first people to receive those. It's a tough situation. It's a tough situation to mitigate, other than pretty much all locked down like they are. I mean, most nursing homes are locked down. But once one person gets infected in the nursing home, like I said, it's the most vulnerable population, the most vulnerable of settings. And I'm not sure if there's places to spread them out to, or where you can move them to. But I do know Seema Verma, the head of CMS, is really focused on infection control policy at nursing homes and has all of her inspectors tasked to doing that.
Okay. Do you know of any funding that's specifically set aside for that cause?
There were some provider nurses. Let me get you the specific. I can get you the specific. Okay. Lauren's on that. I know there was
specific funding levels for CMS.
The CMS for nursing homes specifically.
If there is any specifically for that.
I do know that in the very first cures we increased. So a lot of people in Kentucky nursing homes are on Medicaid. Medicaid pays for a good bit of nursing homes, and the federal government. So Medicaid in Kentucky, I'm not sure the exact percentage because it changes, but essentially for every dollar spent on Medicaid, the federal government spends 70 cents and the state spends 30. And we up that. So we have more opportunities for money to flow that direction. And I can get you the exact numbers on that. Lauren can follow up with you on that.
Yeah, we can follow up with that.
Okay, thank you.
Thanks. How are things in Springfield? Talked to your judge not long ago, and things are a few cases right now, right?
Yeah, we say we have 5 cases, or as the last I checked on it, 5 confirmed cases. So we're keeping it down, which is really good.
Yeah, I talked to the judge, I guess about a week or so ago. Yeah.
Zach with the Advocate Messenger, he's on, he sent me a message. Senator Rob Portman and Ben Cardin are calling on the SBA to allow small business owners with criminal records to apply for the PPP. This has been an issue for some business owners that are in long-term recovery. Do you support this initiative?
I just need to see it. I do know that to qualify for an SBA loan, like a lot of our federal programs have, you have to check off whether you're a felon or not to qualify. And I just need to see specifically what they're addressing. I do know a lot of people, you're talking about, you mentioned recovery specifically. Almost every recovery center I see, and I've been to a lot with the heroin and opioid issue, almost everybody that's at least in management are recovering. And they seem to be and I agree with that because they're the best ones there. They've recovered, so they want to go back and help others. And so almost anybody that's had a strong addiction has some kind of criminal record because they committed crimes to support their habit. Not that they were criminals, but they committed crimes to support their habit. Once they got over their habit, their behavior changed. And so in a limited scope, I would support allowing them to do that. I just need to see the details. The concept of in the area I just described where people are in recovery and recovered and they're running these recovery businesses and they need to have PPP or qualify for PPE, I would have to look at the limit of it, but the concept of what was just described, I would support. We have to really look at our criminal justice and getting people back into the workforce.
This is Lauren again. Congressman Guthrie, I know you have to run to another call within the next few minutes, so just want
about agriculture. So next time we can talk about agriculture.
Yeah.
That's my call with Secretary Perdue, I think.
I just want to open it up to everybody, anyone else who wants to ask a question now.
Okay.
Actually, could I ask? So you actually sparked my brain when you talked about agriculture.
Right.
Trump has signed an order, making sure that these processing plants are going to remain open. What are your thoughts on that and any kinks in the supply chain moving forward?
Well, we've got to keep the supply chain moving forward. And I know, he wanted to make sure that our meatpacking plants were always considered essential, that they couldn't just be shut down. Having said that, we have to be careful about people getting infected and working in the meatpacking. Not that they can get it into the meat, but they get it into each other, and therefore they can't. Then they don't have that capable workforce of moving forward. So I know there's a person that processes meat in my district. We're going to talk with tomorrow. We're going to try to figure out with the local public health department how they can have best practices specifically in this facility. When I say that, it's not any threat to the meat whatsoever. Right, I would eat their stuff today if I had it in my hands. I think it's a fantastic place. So I'm not saying that, but if their workers get infected and can't come to work, then you don't have anybody to process it. So whenever we talk about meat packing and COVID, I just want to stress that the food's not infected. And because people can maybe make that inference, and I don't want them to make that. The inference is the issue is people working next to each other and processing meat. And so we're going to start meeting with these groups of people. We need the food supply to be there. I know I'm staying in Bowling Green. That's one thing about us being home and not being in Washington. We're having experiences. I did a pickup at a grocery store yesterday, and they seemed to we were concerned they'd have enough meat. So we were able to receive it. But those are the kind of things people are really concerned about. I think the thing I hear more than anything, I want to make sure I can get tested if I need to be tested. I want to when's the vaccine coming? and or the grocery store is going to have plenty of facility of stuff for me and for my family, not just me. Obviously toilet paper and other things that are important to everyday life. And so far, our drivers, our grocery store workers, I mean, everybody seems to be up to it. For some reason, it's the meatpacking plants have been struck by this, and I think it's just the nature of the work. They're close to each other and they work close together. And in some areas, like some of our meatpacking plants are more rural, and so they'll bus people from a more urban center into a rural center. So the fact that people are on the bus together is a problem. So that's where they got to get into wearing masks, being as they commute to and from the meatpacking plant. So those are the kind of things that we actually have a call tomorrow about. And I'm doing one in a few minutes with the secretary. I believe he's on that one.
Thank you so much for taking that question. Stay safe, everyone.
Yeah, thank you. Thanks.
Congressman
Eva has one more. I saw her wave.
Oh, no, I just was saying bye-bye and thank you.
Oh, okay.
We have one more
I hope
question. We have one more.
So your family's still well?
Yes.
Eva's family's in New York, for those who don't know her. So they're well?
Yes, everyone's good. Thank you. Thank you for asking.
Thanks. Yeah.
Michael from the Bowling Green Daily News is asking, what are your thoughts on how testing is going at South Warren so far?
I just haven't personally been out there to see. I'm glad that the governor's got the remote testing going. I think we're trying to get more people through the testing program. I just personally have not been to the South Warren testing site to give an update on you for that. Okay.
All right. Anybody else before we end this? And feel free to send me an email or call me. I'm happy to answer any other questions. We can get you the answers for those as well.
We're here working, so call Lauren if you need something specific, and we're available to chat between conference calls. Thanks.
All right. Thank you, everybody.
Thank you.
Thanks.
Bye.
Bye-bye.